The arsenic level, which is a known carcinogenic, 762 times higher.
Cancers due to arsenic. 1/4 of fatal heart disease due to arsenic. Diabetes, 20% of diabetes is due to arsenic. So this one young woman came to me. Her sister just had her kidney removed for her problem. She came to see me and she said,
what if cancer wasn't just the bad luck? What if diabetes isn't about just the diet? What if heart attack wasn't just about cholesterol? And Alzheimer's can be preventable. Your doctors ran every single test on you and every report came back normal. Still, you are not feeling happy and confident in your body. Today, we talk about what is making that happen. Welcome, audience, to the Disease Free Society podcast, where we uncover one hidden truth about better health every week. We understand how our body works. We realize the symptoms, the patterns that our body go through before the diagnosis or the disease appear. I, Swati, along with Dr. Virender Sodhi, is joined by Dr. Joe Pizzorno, a globally recognized leader in naturopathic, integrative, and functional medicine. He is the founding president of Bastyr University, accredited university in US. He has reshaped how doctors should learn, how the wellness should be about, and how the care should look like. Over the glorious 5 years, decades of his career, he has published 14 books, worked on the various presidential commissions and health policy factor effects. Welcome, Dr. Joe Pizzorno, and hello, Dr. Sodhi. You have named this university on the name of your professor, your guru. What was the motivation behind it?
well, that's a good question. So when we started the university way back in 1978, I wanted to give it a spirit. So we looked at what kind of names to give it, like the Seattle School of Naturopathic Medicine or Puget Sound School of Naturopathic Medicine. And I looked at that and said, that doesn't say anything. It just says our location. I want to talk about the spirit. And I decided I wanted to name the school after my beloved professor, Dr. John Bastyr. And the reason for that is because what made Dr. Bastyr so very, very good was, number one, he was extremely skilled. He's very technically skilled. And number two, he was very good at facilitating the belief within each patient that they could become better.
Oh,
So
that's nice.
science plus health awareness and belief.
And you wanted to build the university on the giving that hope to every patient that you will be fine.
Yeah. So, and I say to the students, you're here to become physician healers.
Oh.
Not just a physician, you're a healer as well. And by combining both together, we get the best results for our patients.
Dr. Pizzorno, you have researched extensively about toxins and environmental factors. In your research, what was that one thing or one cause that you could say that yes, this is it, that where the disease begin in the body? What was that thing?
Well, thank you. That's another really good question. So as I started becoming curious about environmental medicine, I all of a sudden noticed the huge increase in diabetes. I think, wait a minute, when I was in private care, when I started in private care way back in 1975, it was 6 months before I saw my first diabetic patient. You might say, well, as a young practitioner, I was just starting, it takes time to build practice, and it does. But within 6 months, I was fully booked. Within a year, I had a 3-month waiting list.
Oh my God.
So, because, I was helping people. So I was so excited when I saw my first diabetic patient, because diabetes affects only about 1% of the population. Now it affects 15% of the population. What happened? So I was looking at this, well, our genetics didn't change. Our diet's not very good, but it did get 15 times worse. What happened? And I started looking at the research on environmental medicine and started seeing that as the levels of these metals and chemicals in the environment got higher, we started seeing more diabetes. And when I was looking at the researchers started calling these metals and chemicals diabetogens because they were causing diabetes.
Dr. Sodhi, from your Ayurvedic lens, you have reversed diabetes. We have talked about that. There are many patients that you just reverse their diabetes. You have been talking extensively about it. What is the Ayurvedic take on the diabetes?
Swati, before we go for that route, I would like to say 92% of folks, 92, is related to the toxic load in the body. So look at the extent of it. It's 92% is huge. And still nobody's talking about it. I think thanks to Dr. Joe Pizzorno to bring it to the limelight of the scientific world. And did we make any swing in the needle? Not yet. So the Ayurvedic concept is very simple. It says, my body is an environment of its own. We call it a pinde, pin body. And we said, yatha pinde, what is true in the body is true in the universe.
Okay.
So very well aligning, the thousands of years we are realizing the same thing. What is in the environment is also present in my body. If I mess up with the environment, it is going to mess up my body. So, and now there is a lot of research on microbiome and this and that. But look at that. We are messing up the environment.
Nobody is talking about all these things. I think this is for the first time I'm getting to know that diabetes and toxins, they are directly related. Diabetes is usually related to sugar.
Yes.
Quoting both of you back, 92% of diabetes epidemic is toxin.
That's right.
When you present these numbers to our conventional physicians or doctors, what is their reaction? We'll start from you.
So I've been doing this, and what they say was, okay, well, I'll do a clinical study and prove that this is the problem. And I said, well, you mean I do a study where I can decrease toxic load in people and improve their diabetes? They said, yes, great idea. But all the research money is to test drugs on diabetes, not test cures, okay? So I've had to do some self-funding of some research, and Dr. Sodhi actually very generously donated to that project. And unfortunately, previous leadership at the institution got distracted by conventional medicine and never did the study for which I raised $175,000 to prove this works. But now, having said that, and since then, on my own seeing patients, I found that when I decrease patients' body load of diabetogens, their HbA1c, which is a measure of blood sugar control, gets better. Without question. Get the diabetogens out, the body heals.
Starts functioning. What would be your take?
So the thing is, as I said earlier, you need to change the environment. And it starts at me first. Our food is toxic chain. We have pesticides on it. We have insecticides on it. Our water. I was surprised. There's a.
I mean, you have studied that. Yeah, exactly. I remember that Bellevue district that you mentioned.
The Environmental Working Group, ewg.org, this wonderful website. And I put my zip code of Bellevue, 98004. I was completely blown off, Swati. The arsenic level, which is a known carcinogenic, 762 times higher. Not one, not two, 762 times higher than allowed limit.
Yeah.
So, and the simple solution is simple. Clean the water.
Yes.
Put filters on it, put reverse osmosis. There is a pro and cons for both of them. But yes, you remove something, but you have to add something, which is mineral, which you can easily add it. So our gut is not processing it. The fiber actually pulls things out of you. Plus, it makes a lot of good chemicals by the microbial fermentation in our body, which is very protective of cancer, of anything, even in diabetes. So we are not doing the right things, and then we say, okay, here is a metformin, or here is a herb, Gymnema sylvester. It's going to do this much. It's not going to do the big job there because you are not doing the right thing.
So Dr. Joe, you mentioned that the world has changed in last 70 years more than it has changed in last 70,000 years. And somebody listening to our conversation, maybe they are fit, they are having a healthy diet, running properly, having a sleep pattern routine, but still diabetic. What would be your message to them?
We now suffer the highest burden of chronic disease ever in human history. Now, conventional medicine will say, well, it's because people are living longer. And people are living a bit longer, but not as much as has been promulgated. But what's more importantly is that high load of chronic disease is in every age group, not just older people. And why is that?
Age group?
Every age group has the highest burden of chronic disease ever in human history.
Even kids?
Kids are getting diabetic.
It's even worse in kids.
Oh my God.
Diabetes, obesity.
Yes. Kids are getting diseases they never had before. They're getting adult diseases as children.
Yes.
Where are we heading? I think this is...
And the good news is it's all controllable.
Arsenic accounts for 1 out of 4 cases of cancer.
Yes.
I mean...
And arsenic is in the water that we are
consuming. Arsenic in the water, yes.
Yeah.
I mean, there's these simple things that we could address that would hugely decrease our burden of disease. I mean, talk about arsenic. 1/4 of cancers due to arsenic. 1/4 of fatal heart disease due to arsenic. Diabetes, 20% of diabetes is due to arsenic. Gout, 50% of gout is due to arsenic. I mean, it's like all these diseases we're having, they're all due to just a simple thing of arsenic, and we can clear out the water and we can help our bodies detoxify more quickly and avoid those diseases.
But then pharmaceutical companies will not be
money.
benefited.
No money, yeah.
There's no money in there.
Yeah.
I think, Dr. Pizzorno, you should talk about Flint here, which has the lead poisoning stuff there. And there was some, I think I read a study there where the kids who were playing basketball didn't have the lead levels of the other common public. So can you just elaborate on that?
So what happened in Flint was really unfortunate. The city of Flint decided to stop using the Detroit water supply and do their own water supply from a local river. They did not appreciate that Flint, Michigan is where a lot of the auto manufacturing had happened over the last many decades. So the environment and the water are heavily contaminated. So when they moved to the Flint water system, they did not properly address the pH and the chemicals in the water. So when it went through the water supply, when it hit old leaded pipes inside, it picked up a lot of lead, and people drinking the water got a lot of lead. Oh. And so it ended up being a national crisis because they were basically poisoning their population by changing where they're getting the water from. Now then, I was asked to come in to develop a wellness program in Flint, Michigan. And so when I look at wellness programs, I wanted to say, well, first off, what's the nutritional status? What's their toxic status? So I was looking at what toxins to measure. I looked at a website published by the department, the state government, and it showed that 40% of the water supplies in the county that Flint, Michigan is located at arsenic levels high enough to induce disease in humans. It was right there in their own data. Here's the threshold, and all these 40%.
But nothing is done. I mean, nothing is done. We are still.
So that's what I'm saying. It comes to me. I am responsible for my own health. I cannot depend on my doctor or anybody else, not even government.
And even disease to just get diagnosed for doing that. We need to. So what are the 3 non-negotiables that somebody listening to our podcast should start right now? Not a week after, not a month after. Right now, give me 3 non-negotiables, maybe 2 you, 1 you, however you guys go.
I'll give my 3, you give your 3.
That would be
and by the way, something I found really interesting that as more and more I've studied Ayurvedic medicine, how similar naturopathic medicine and Ayurvedic medicine are.
That's right.
They overlap so very much. So number 1 is food, without question. I would, as near as I can tell from looking at a lot of research, about 60% of our toxin exposure is from food. Now it's not 60%, but it's not just from the food. It's also from the packaging materials we put the foods in, and it's in
plastic.
Plastics there, and then the utensils we use in our kitchens to cook the food, they put toxins in as well. So you have to. So I'm saying.
I mean, we are not clear at any level, be it cooking, be it bringing it from the market. We are just consuming wrong things. We are feeding our body something really wrong.
Yes, all the time.
This is what I'm getting here.
Yes,
and it's scaring me.
Well, you have so much disease. Yeah. I look at someone like my great-grandfather. My great-grandfather lived to 95 years of age, never saw a doctor in his life, had no apparent disease.
Yes.
So that's what I expect to happen. Whereas instead, what's happening is not that people not making age 95, but we have all this huge burden of disease. Everybody's sick. And I'll say, I've got gray hair. I'm kind of an older guy. I would say almost half my family and friends in my age group are now dead. Mm-hmm. And if they're not dead, they're full of chronic disease. It is so sad to see. And myself and my wife, we continue to live a high quality life without disease. We don't take any drugs. We're healthy. That's what I expect it should be. That certainly is not the case.
So number 1 was the food. What's the second one?
So number 2 would be the water.
Water.
Yes. And on the water, well, it can be expensive to get a really good filtration system. Everybody should have their water measured, just like you did. Yes. Have your water measured, see what's in it, and make sure you get a water filtration system that clears that out. And the third one is I think everybody should have a whole house air conditioning system with a very sophisticated filter system.
Okay.
Because it turns out, particularly I live here in Seattle. Anybody living in Seattle, you get all these. Anybody living in the city, you get a lot of toxins. So what we do is we put into our system a very high quality filtration system that it has a rating called MERV, a MERV rating. You want a MERV rating of at least 12. We have one which is 16, which is the highest you can get. And that clears up 99.9% of the toxins from the air. It is so effective that so we have a housekeeper to come every couple of weeks to help us clean the house. After we put the air filtration system, they said, "What happened to your house?" We said, "What happened to our house?" They said, "There's no dust anymore." It was so effective at cleaning air, there was no dust anymore. And that's important because you look at the dust, it's full of mycotoxins and lead and all this stuff is really vast. So by decreasing that, it clearly improved our health. So what I tried to do when we're looking at how to decrease toxic load, you can look at active things and passive things. So active things are, okay, you decide not to eat that candy bar, for example. It's an active decision. A passive decision is you don't have to make a choice. So by cleaning the water and cleaning the air, you don't have to worry about what water you're drinking, what air you're drinking. It's already clean. But eating organically, you don't have to worry about what foods you're eating because it could be cleaner.
Well, the cooking easiness comes, especially non-stick pans. It's easy. Food doesn't get stick. And my wife brought them, and she will still use them. And so she happens to go to India. What I do, I took all of them and threw them garbage and bought the new pans. So, because I have to go to that drastic. Because I think her point of view is ease, But she don't realize, she's not a doctor. She don't realize that what toxic load she's putting in our bodies. And she had a bout with her breast cancer. Should I ever tolerate that? Not at all. So I just completely, so that is thing which we need to do sometime drastic, but it's important because it's for health. So I agree 100% what Dr. Pizzorno is saying, that we should be doing that. And the other thing which I want to add is, the mind, power of mind. Okay. If I want to be healthy, nobody can make me sick.
That's my choice.
That's my choice.
That's my choice.
Yes, health is my choice. Completely my choice. So putting the mind, and like I do with my cancer patient all the time. So, if the body can create cancer, it can destroy it. And we call it spontaneous remission. There are thousands of cases reported in the literature. Nobody is looking to research that, why the body got into spontaneous remission. They have stage 4 cancer, and all of a sudden, body clears it up. So there is a mechanism, the body can clear it up. But we are not studying it.
Because it is built that way. Our body is designed to self-sustain and help it remain disease-free, but we ourselves are corrupting it.
Exactly. So mind power of mind is very important. So sending the right message to the body. And the exercise and stress reduction, like Dr. Pizzorno talked about the air. Prana is the basis of Ayurvedic medicine. When you breathe in the air, and every cell in your body is getting oxygenated, and your mitochondria, which is the lung of your cell, is getting activated. And now we are talking about mitochondrial dysfunction. There's a big, subject of mitochondrial dysfunction. This is happening because we're not breathing properly. And on top of it, we are making toxic loads on it. The body is saying, okay, I'm done with it.
I'll go back to your comment about mind and people's beliefs. Sometimes you'll see a patient that is so dramatically demonstrating how important our belief in our health is and our belief in having diseases.
Yes.
So I remember this patient came to see me, a 30-year-old woman. She was a nurse, and she came to see me for a condition called renal artery stenosis. So what happens because of genetic susceptibility, people build up scar tissue in their arteries going into the kidneys. Kidneys think, there's not enough blood available, starts absorbing sodium, and blood pressure spikes. Okay. And at that time, this is quite some time ago, at that time, the only intervention was surgical to go and remove the kidney with the stenosis in it. So this one young woman came to me. Her sister just had her kidney removed for her problem. She came to see me and she said, I have the same condition. My doctor confirmed it. And is there an alternative medicine approach to it? So one thing that I learned in practice was diagnose first, treat second, and don't trust someone else's diagnosis. So when she came in, of course, I checked her blood pressure and it was elevated. So, okay, fine, that's the first thing we'll find. The second thing is, there's certain hormones that build up in the urine that are confirmatory. And that just had not been run. So anyway, this woman had come in. I said, okay, fine, let's run this test and see what happens. So she came back, had the results of the test, and she saw high blood pressure. And I said, well, I just did the test, and you don't have this condition. You don't have those abnormal hormones in your urine. She looked at me, and you could see her body go, 2 weeks later, her blood pressure was normal. She had been scheduled to have her kidney removed. And as the last ditch thing to hope for something better, she came to see me a week before it's supposed to be removed. So she didn't lose her kidney. Because I said she didn't have the condition. But she thought she had the condition, so she reproduced all the same symptoms.
All the symptoms.
Yeah, just remarkable.
So the aspect, I mean, it's our mind that we need to train. You would want to tell our audience that train your mind that I am fit. What will be your?
So I tell it a lot, like, your body is like a hardware, and then you write software on it, and your mind is the one which writes the software. And if you believe you're gonna have a disease, yes, you bet you're gonna have a disease. And if you believe that the body, which is actually naturally equipped to get rid of the diseases. If you look at, like right now, we are getting around 2 teaspoon worth of plastics in our blood. The brain has 2 teaspoons of plastic. But doing simple exercises, sweating, you are getting it out of it. The body knows how to get rid of it. And it adapts, by the way. And automatically adapts. We don't sing it to do adaptation. It does it automatically. So I think believing in the body and doing the right kind of activity. We talked about fiber, we talked about exercise. Like when we did the one reel, remember? Your calf is your second muscle.
Yes.
Like there are studies done in India where they took the seamsters who sew, and there is an old-fashioned machine, hand machines, and the electric machine, and there is an old-fashioned with the paddle.
Sewing machine with
the paddle.
Sure.
They couldn't find any 100,000 people, couldn't find any diabetic in that ring. 100,000 people they screamed. Nobody. Because you're using, so body first thinking is, I'm walking. The process is natural. Okay, you're walking, I know how to deposit your blood sugar into glycogen. I know what to do. I know I can store that in the liver, I can store it in the muscle.
And so saunas and sweating, extremely effective.
Wonderful.
It detoxifies every poison I've looked at with one exception. And that's the perfluorinates, the forever chemicals. They don't go out in the sweat. So I've been really struggling with how to get rid of perfluorinates. I'm curious, what's your thoughts? I think we need to figure this one out because it's causing more and more disease.
That's right.
Our bodies can't get rid of them. They have the half-lives in the body. By the way, it takes 4 half-lives to get something out of the body. Half-life of the perfluorinates is 2 to 7 years.
Wow.
Once these things come into our bodies, forever chemicals, they are forever.
Yeah.
We can't get rid of them.
Yeah.
So from the naturopathic lens, what is the one practice you feel like is underutilized in this field?
Eat real food.
Yeah.
I mean, when I say real food, I'm talking about foods that are properly grown, properly prepared, wide diversity. I've written 3 editorials on a topic I kind of tongue-in-cheek defined as unimportant molecules. And why I did that is because if you look at when most of our core nutrition research was done, it was done about 100 years ago when our understanding of physiology was pretty limited. And we're pretty much only doing research based on what was necessary to keep animals alive.
Okay.
So you found out these vitamins and minerals, amino acids, etc., that's necessary for life. Okay? There's 43 of them. So then food was grown chemically rather than organically. As long as those 43 molecules and elements were mainly maintained, it was considered okay, that food is fine. But you have to ask yourself a question. Are there other things in food that might be important as well? And it turns out, if you look at all the foods of the world, there are 50,000 different molecules in food. So we decided that 99.9% of the molecules in food were not important when we grow foods chemically.
Oh.
We just started looking at those things. The polyphenols, the carotenoids, the flavonoids, fiber, all these other factors are critical for health. So I say to people, not only do you have to eat organically grown food to avoid all those toxins, but also organically grown food has way more of these other molecules in it. And that's why organically grown foods taste better than chemically grown foods, because they have all these other molecules. So I tell people eat as diverse a diet as possible, get as many different molecules in your body as possible, because that's what we evolved on. Our body's expecting of all these other molecules, not just the vitamins and minerals, but all these other things as well. Yeah. And we've lost them from the food supply.
Yes. What I tell to my patient is eat like a diverse, what the Mother Nature provides.
I mean, you have been telling about it. Eat in the right season. There are
exactly.
the seasonal thing.
And the season changes. Mother Nature is more intelligent. For millions of, it has experimented. We talk about the experimenting and the research. The Mother Nature has been doing research on us for millions of years. And my DNA has shaped from my great-great-great-grandfather. And how that has shaped is through what kind of stresses it went through, what kind of nutrition my body was taking. and I survived until this one. So I think what we need to look at is its seasonality. There is a data, there is a longevity which is more than sufficient to prove that what we are saying have done in that medicine for thousands of years is true.
5,000 years.
Yeah, more than that. Like 5,000 we just talk because there's no, we don't have a reference point for that. We say 5,000. But now they are finding some excavations back in India and the underwater. There's it's mind blowing. So I think what we need to do is learn what Mother Nature wants us to do. Follow the simple rules of Mother Nature.
We are complicating our lives, I would say that. So we
Exactly.
should just simplify it and then start living healthy.
Like most of us, we are using computers and cell phones and the TVs, and the blue light is hindering our deep sleep because it's not allowing the melatonin to come at a proper time.
When you look at the history of medicine, while there's many different names of various professions, there's actually only two schools of thought. One school of thought believes the body makes mistakes, is the victim of disease. The role of doctors is come in and take control. Well, sometimes that's useful. Massive infection, broken bone, where the case may be. But there's another school of medicine. They might call this disease medicine. Another school of medicine says the body has tremendous ability to heal. And the role of the doctor is, when there is disease, what is blocking the body's ability to heal? Okay. So that might call health medicine. Each has its place. Yes, we clearly need disease medicine. But if you don't deal with health medicine, what happens? You get more and more disease. And not only have we not only paid enough attention to the health medicine side of it, which is what we represent, but this disease medicine group did everything they could financially, politically, socially to suppress this way of thinking about medicine. Because this way of thinking about medicine means you need less doctors, you need less drugs, you're more in control of your health, you have more vitality and a longer life. So this is what this is about, and this is why I'm just so honored to have incredible graduates like Dr. Sodhi continue to spread this word. It's because there's so much opportunity for health that people have, and we have to get out of the disease mentality, get out of this victim mentality, because we don't need that. It's not real.
So Dr. Joe, you have given this conversation the direction, the science it deserves.
Yes. Well, thank you. So when I created Bastyr, I coined the term science-based natural medicine. So I told people this body of knowledge has so much validity, and one of the things that we can do is now bring forward the science. So that's why Dr. Murray and I wrote the Textbook of Natural Medicine way back in 1985. It was the first time anybody ever compiled all the research that supports this way of looking at health.
Thank you, Dr. Joe, for the work you have done, the institution that you have built, and the courage it takes to bring this data out and back it scientifically. I am extremely thankful, and I think I am honored to be here having this conversation with the pillars of naturopathic and Ayurvedic medicines. Thank you for your time. So disease does not begin on the day of diagnosis. It creeps in silently in the water we consume, the air we breathe, and the products we consume, years before the symptoms appear. And the disease-free society begins the moment we refuse to acknowledge that. Thank you, viewers. Share this with someone who you want to live a disease-free life. New conversations every Wednesday on holistic health, because awareness spreads health.